1 year since public health officials in 6 Bay Area counties announced a first-in-the-nation stay-at-home order. Now, we ask if some vaccine shortages could be part of political payback. Good evening, I'm Elizabeth Cook.
I'm Alan Martin. KPIX5's Devin Fehely spoke one-on-one with Santa Clara County's top health experts on the challenges of containing the deadly coronavirus.
That we needed to take swift action as soon as possible.
It was an unprecedented decision.
A number of our cases are hospitalized and some requiring intensive care.
In the face of a newly emergent virus,
every unnecessary contact with another person increases the chance that the virus may spread.
And worsening outbreak.
What were you seeing that all of the rest of us wasn't, where you said, you know, this is really serious and I need to take action urgently?
We had very little information, but the information that we did have was pretty terrifying, to be honest. Everywhere we looked, we started to find. And we also knew that we didn't have any other tools available.
When the lockdown was first announced on March 16th of last year, there were 32 confirmed cases of the coronavirus in Santa Clara County. 5 people had died. In the years since, the numbers have skyrocketed. More than 112,000 have become infected, and nearly 2,000 have died.
Do you look at those numbers and say, did we fail somehow?
There weren't any other good options on the table, and it was very, very clear that acting faster was better than going more slowly.
Dr. Sarah Cody has been praised for her quick action, for a lockdown that slowed the spread of the virus and saved lives. But she's also been criticized for the harm it's done to people's livelihoods, to their jobs and businesses.
And what they would say to me over and over and over again is, if I lose my business, I can eventually rebuild and get it back. But if I lose my life or if a family member dies, that's it.
Dr. Cody says the rollout of the vaccine will prevent countless deaths and eventually allow us to lift the last vestiges of the lockdown if, and it's a big if, we get enough doses of the vaccine.
How worried should we be at the pace at which people are getting shots in the last 2 weeks?
We need more vaccine. You know, we need to shout it from the rooftops. We need more vaccine. We have the capacity. We have the people that want the vaccine. We do not have the supply.
Dr. Cody and County CEO Dr. Jeff Smith have been deeply critical of the state's plan to hand control of vaccine distribution over to Blue Shield. The county was one of the first to opt out of the system, leaving some to wonder if the recent vaccine shortage was political payback.
It's still very unclear who's making the decisions and why. We're left to stand here with vacant appointments waiting for vaccine. So it seems quite frustrating at this point.
Devin, hindsight's always 20/20, of course. If she could do something differently, did Dr. Cody say what her biggest regret is?
Yeah, Dr. Cody says she's always been a really strong advocate of sort of working in concert with the other counties in the Bay Area, kind of moving in lockstep with them as they either eased or tightened their restrictions. It's kind of just a recognition of the fact that this virus doesn't respect lines on a map. And she says last spring, we did a pretty good job of bending the curve of getting the virus back under control. And she says at the time there was enormous pressure to begin to reopen the economy. She thinks as a region we did that too soon, and she was complicit in that decision because she ultimately went along with it and believes that that may have allowed the virus to escape our control yet again.
Yeah, flatten the curve. We did hear that a lot. All right, Devin Fehely, thanks so much. Good insight.